Good morning. I'm Kelsey Ruff-Smith, Director of Programs here at the Community Foundation for Ocala, Marion County, Florida. And joining me this morning is Jessica McCune, the Community Outreach Manager with Hospice of Marion County. Good morning, Jessica.
Good morning. How are you, Kelsey?
I'm wonderful. Thank you for asking. And how are you doing with everything going on?
We are doing well. I've been so proud. The organization's over 35 years old, and our commitment is to provide extraordinary, compassionate care at end of life. And of course, that has still gone on during this horrific pandemic. So, Hospice of Marion County staff has continued to go out. I know they've been nervous. We've been working hard to provide them with PPE, but Hospice of Marion County as well, and I'm very proud of them during this time.
I can't wait to talk to you more about this. So for those who might not be familiar with hospice, I'm not sure how, could you tell them a little bit more about what your nonprofit does, who you serve, and what needs Hospice of Marion County fills in the area?
Absolutely. We provide palliative care and dignity at end of life. Our tagline is feel better, live better. We want people to live every day of their lives feeling as well as possible. And that is a goal. A hospice diagnosis, if we had a crystal ball, would be in the last 6 months of life. We have 4 different companies, a pharmacy to provide medication, every day for our clients with no hassles. We have the palliative care company, we have a durable medical equipment company, and of course our clinical teams going out in the community to people's homes to provide them with compassionate, extraordinary care at end of life. And we've been here for 36 years, not for profit. And so proud of Marion County. It has grown, and so have we.
That's
Does that help
fantastic.
understand? Mm-hmm.
That's great. Sorry, go right ahead.
No, I just said, does that help answer your question?
Yes,
Did I get
100%. It certainly does. So now with everything you've got going on, you've kind of alluded to it with the PPE and some of the other challenges. What are the biggest issues that the Hospice of Marion County is facing right now due to the coronavirus?
It is the supplies for personal protective equipment, PPE. Our volunteers have made over 2,500 masks for our staff and for anyone that could need them, for our families, for patients, and we have used every single one of them. And now they're making gowns for our staff. They have when you sew, you need a pattern. They now have patterns for the PPE and are sewing them like mad. It is so inspiring to be at the office and hear those sewing machines just humming in the Elliott Center, and a lot of them are working at home as well, social distancing when they're in the office.
That's great. So it sounds like that's something that you can be pretty proud of. What are you finding that you're most proud of right now in all of this?
Well, the staff showing up. They have not called out. They are going to people's homes. A lot of them are very nervous. A lot of them are caring for their own families, kids at home. And of course, everyone's very concerned about practicing social distancing, not exposing ourselves to anyone and then taking it back to our loved ones at home. But the staff has risen to the occasion, and it is most heartwarming. And of course, we've all experienced so many moments of inspiration and silver linings during this unprecedented time. And while it's so sobering to look at the forecast, we see what people are doing every day. So it's been incredible. My life being deemed essential has pretty much been the same, going to work every day or working from home. And I'm sure you've experienced a lot of that yourself.
We have. We actually, some of us stayed in the office the whole time, while others opted to work from home so we could have a little social distancing here. But obviously, we want to be able to help our nonprofits too. So I know that you understand.
You've done a great job. I've loved
you're so sweet.
You've had so much information for us these past few weeks.
Jessica, that's great. We want to be a help. So with that, our way of helping you, how can other people help you right now, or who is it specifically that you need the most help from today at hospice?
We always need help pushing back against our culture's fear of emotional pain, grief, and death. So we offer classes at our bereavement center. We want people to embrace death just as if we've embraced this pandemic, and there have been things to learn. So education about referring to hospice, anyone can refer. The number's 873-7400. Our admissions desk is answered 24 hours a day, and we have 13 to 15 doctors on staff that can come to you to evaluate if the diagnosis for hospice or palliative care, which is comfort, is available. And again, it's 873-7400, and the admission number 24/7-873-7415. So with helping us with education about end of life, planning, plan. And then if there's any seamstress wizards out there that would want to join the campaign for making PPE, they can call the volunteer office at those same numbers. And that would be great. But we always need help. I always say you will know someone needing either emotional support at end of life, information about palliative care and hospice, or grief, and how to embrace that so we can make the most of it. Does that make sense?
It totally does. And I love the work that hospice does. It's been dear to me in my life, even just, as long as I've been here. Hospice has had an impact on me. So I'm very grateful for the hospice services. And if there's anything else we can do, please let us know, because we love hospice here too. One more time, Jessica, can you give those phone numbers, the best way for people to contact?
I can. I'm going to say one more sentence too, just to squeak in some more education. Palliative care is so hard to understand the difference between hospice care and palliative care. And the simplest illustration is all of hospice care is palliative, comfort measures, but palliative care is for people that are nowhere near the last 6 months of their life. And they have multiple disease processes. They're having a hard time with symptoms. They need comfort to get stronger, to manage these diseases and feel better, live better. So going on palliative care does not have the big, scary emphasis of hospice care. So all of hospice is palliative care, but not all of palliative care is hospice care. So that's something I teach everywhere I go. And the numbers, thank you for asking again. The 873-7400 is our main office. That'll get you to any of our 4 different companies. And the 24-hour admission. And you can call, someone who's taking care of their loved one. They can't see the decline. You can, a neighbor. Just call for a referral, and a physician or a nurse practitioner will come out to help to get the support that you need. And that answer 24/7 is 873-7415, our admissions desk. Thanks for asking, Kelly.
Of course, Jessica, thank you so much. Is there anything else you can share with us today before we disconnect?
Well, the most rewarding moments in my career have been volunteering. So I love not-for-profits, and I love what you all are doing. Kelsey, you've just been great, and putting this on the YouTube videos is fabulous. Thank you so much.
You are so welcome. If there's anything else we can do, just reach out.
Okay, thanks.
Of course. Take care. Have a great afternoon.
Be safe.
You too. Bye-bye.
Bye.